Pfizer calling for authorization for a fourth COVID shot. The drug maker says data from Israel suggests it's beneficial, but that fourth shot would only be for those 65 and older. Taylor Tashef reports.
Pfizer's fourth shot is for the over 65 population, an age group that's been hit the hardest by the pandemic. But Dr. Muhammad Ali, the lead infectious disease physician at Penn State Holy Spirit Medical Center, isn't so sure the fourth dose is needed right now.
I think it's not really clear whether we require a fourth shot and especially the timing of it.
He says that's because the vaccine is still doing its job.
Essentially, it is holding up against severe infections and hospitalization very well, more than 90% of the time.
But that doesn't mean the fourth shot won't be needed at some point, especially if there's a new variant or a new wave of cases.
What we have learned from this pandemic is that, you cannot rule anything out.
In terms of the 65 and older population, Dr. Ali says cases and hospitalizations are down.
Generally, people who've been vaccinated and who've been boosted especially have had a very mild course.
Pfizer said health records of more than 1.1 million Israeli seniors showed confirmed infections were 2 times lower, and rates of severe illness were 4 times lower among those who got 2 boosters instead of just 1.
I think the Israeli data is clear. Follow the science, follow the data, get boosted.
But the main question is, how soon could seniors be advised to roll up their sleeves?
We have been closely following the CDC guidance, so we really are waiting for that information to be evaluated.
Ultimately, the CDC has to make a decision, particularly the CDC advisory committee that is made up of physicians, scientists who are experts in this field. They make a recommendation. Ultimately, their recommendation is voted on and accepted or not accepted by the CDC director.
Taylor Tashef, ABC 27 News.